we're talking about shoulder tendinitis, it's a combination of overuse and misuse sometimes in the way people are serving and the way people are performing the sport?
There's so many factors at play. Equipment, right? Maybe your racket is too heavy or the strings aren't at the right pressure. You have your form. Of course, if you're trying out a two-handed backhand and you've always had a one-handed backhand, that could all of a sudden cause you to have an injury. And if you decide to compete in a game where you're serving more often or more overhead volleys, that's going to increase your chances of having something like tendinitis of the shoulder.
And before we get into the specifics of tendinitis, generally speaking, you do not necessarily feel injured until the next day, right? So you're playing a sport and everything seems fine.
By definition, tendinitis is an inflammatory process, which means that sometimes it takes a few hours to even a couple days for that process to take hold. Once that inflammation happens, that's when you'll start to feel the pain, whether it's when you go to put your seatbelt on, when you go to, if you're a woman, to hook your bra, if you're going to grab something overhead, that's when you'll start to feel it. And you may not even at the time relate it back to playing tennis that weekend.